Good afternoon, everyone. Thank you for all of you joining us in the room and online. We will begin this press conference by Ms. Tlaleng Mofokeng, who is the UN Special Rapporteur on the right to health, on the right of everyone to the enjoyment of the highest sustainable standard of physical and mental health. She will talk to you about her report, her recent report on harm reduction for sustainable peace and development, which she presented to the third committee. And just a reminder that after her press conference, we'll also be joined by another Special Rapporteur, which is Dr. Alice Edwards, which is the UN Special Rapporteur on torture. With that, further ado, you have the floor. Thanks, ma'am.
Good afternoon, colleagues. I welcome this opportunity to speak here today with you in my capacity as the UN Special Rapporteur on the right to health. And on this occasion of the 79th session of the General Assembly, where I presented my fourth thematic report, which focused on harm reduction for sustainable peace and development. For millions of people throughout the world, the enjoyment of the right to the highest attainable standard of physical and mental health remains a distant goal. And in many cases, this goal is becoming even harder to reach. So this report that I presented on harm reduction for sustainable peace and development builds on well-established premise that health and human rights are mutually reinforcing frameworks, meaning that a human rights-based approach can actively contribute to and at the same time benefit from public health tools such as harm reduction. The report explores the models of harm reduction, of course applicable in the ways that we immediately understand around drug use, but also expands to other important aspects of HIV exposure, transmission and non-disclosure, abortion, same-sex relations, sex work, that are central to sustainable peace and development in how it spotlights populations that are often stigmatized or criminalized or discriminated against, who are living at the intersection of marginalization to the detriment of the enjoyment of their human rights. And so harm reduction in this report is to be understood as a comprehensive paradigm and a framework of how we can get to sustainable peace and development that includes meaningful participation of populations and rights holders who often face historic and ongoing forms of discrimination and marginalization. Of course, preventing and redressing harm are aspirations that have long steered societies and their use of the law, including in the realm of health, where the do no harm principle has guided us for many years. And as a practicing medical doctor, that's one of the first principles of medicine that one is taught. However, we know that harm can present itself in numerous ways. Sometimes it stems from certain behaviors or substances. Other times it stems from not the behavior or the substance themselves, but rather from how states address them, or sometimes not. And so harm reduction is a multi-sectoral, multi-level issue that requires good governance, including participation, transparency, and accountability as key factors to the process. Harm reduction aligns with the right to health and the right to health framework of accessible, affordable, acceptable, and quality care, and many other related rights that get unlocked when you realize and promote the right to health. And in the context of universal health coverage, for example, in situations of vulnerability, including the climate crisis, conflict, health emergencies, we see harm reduction as a principle, as a paradigm, but as a roadmap to ensure that we truly leave no one behind. And in that case, my report provided good practices to member states as received from them as well as other stakeholders, but also recommendations that I make to operationalize this harm reduction approach and lead us all to a path that creates the conditions conducive to a life of dignity of all people. And some of the conclusions and recommendations are that stigmatization, criminalization, and discrimination are all public health issues because they contribute negatively to health outcomes for individuals and communities. And then the over-reliance on the criminal justice system and punitive laws for public health outcomes is misplaced. In the context, of course, of the ongoing genocide in the occupied Palestinian territory, the realization of the right to health is untenable. That's just one example of how harm reduction is applicable in situations of crisis, where health workers themselves are exhausted, harassed, killed, impeded from fulfilling their tasks as first responders in situations of emergency. And for months now, they've been working in dire situations under bombardment themselves, where they're performing surgeries without anesthesia and other essential medicines. All of us continue to bear witness to the very practice of medicine that is being under attack. And so the right to health in the context of war, in the context of genocide and protracted conflict, even in the areas such as Sudan and Congo, shows us that we cannot but move forward in the demand that human rights take center stage in how we analyze, understand, and want to solve the world's problems for sustainable peace and development. And so through my mandate on the right to health and as the UN Special Rapporteur, I continue to use all of the tools and methods available to me to continue on this unreasonable but hopeful path that all people everywhere can realize the right to health, that their right to health can be promoted, fulfilled, and respected, and that at all levels, clinical level, health systems, and underlying determinants of health, those conditions can be created that are conducive for an equal opportunity to realize the right to health. And I echo the call for an immediate ceasefire, to the end to the occupation, to the end to the genocide, as part of what it is that we owe each other as humanity. Harm reduction overall, as presented in this report, requires us to end criminalization, to end stigmatization and discrimination. It demands a compassionate and inclusive approach that guides member states in how to achieve good health for all people. And harm reduction will improve trust, improve dialogue, creativity, and the innovation required in this space and in this urgent moment of a paradigm shift. Thank you very much.
Thank you, Ms. Mofokeng. We'll open now to questions. Gabriel, please.
Hi, thank you very much for your briefing. My name is Gabriel Elizondo from Al Jazeera English Channel. Your briefing comes at a time when just yesterday another healthcare worker was killed in Gaza by Israel. The healthcare worker worked for Doctors Without Borders. It's the 8th healthcare worker, humanitarian worker, just from MSF that's been killed in Gaza. My question to you is, and you brought it up a little bit in your remarks there, but how much is this Israel's war on Gaza and on their healthcare workers in the context of human rights impacting now and also in the future the protection of healthcare workers in the context of your report?
Thank you for that. And for the record, I am in contact with the government of Israel on many of these matters that are affecting the occupied territory, before, of course, the genocide, but definitely in regards to the medicide, which is a new term that we've now are using for the incredible destruction of health systems and the attacks on healthcare workers. And I recently released a press statement when Dr. Ziad El Dado actually was confirmed dead while detained. And that was on the 24th of September. So those issues remain very high on my priority list. It sets a precedence that healthcare workers do not enjoy protection and that there's impunity when the people violate international law. And I think in the same way we understand the work that journalists do as human rights defenders, this genocide has shown the incredible work that doctors and healthcare workers and other care workers do in defending human rights in a way that I don't think we had seen before. They are the oath takers. They are the ones who refused to leave and evacuate, and they stayed knowing what their fate was, and they stayed caring for their patients. And so to let you know that I am in contact with the government of Israel and have communicated with them my concerns directly on these issues.
And what does Israel say?
So currently I'm awaiting response on this one. Because of the working methods, things take time. However, there has been collective work between myself and other special rapporteurs who have been making really clear public demands in terms of accountability, investigation, monitoring, and the immediate call for a ceasefire remains what it is. Under the current bombardment, there isn't much that can happen, and that's where we need to start. While everything else, the negotiations are happening elsewhere. But we do need that immediate ceasefire, and that's what we need to really be advocating and making sure that we can get.
Last follow-up, if I may. In any other conflict that you've looked at in recent memory, or even further back, have you ever seen an instance where healthcare workers have come under attack as they have?
No, there's never been. There's never been. I mean, if you look at our own colleagues who are UN staff, all right, even outside of healthcare workers, we've lost more staff in this period, dramatically in numbers than compared to many other periods in history. And that is the problem, is that we are setting a precedence. I feel like we are unlocking new levels that we can never undo. And we need to be careful of how far we allow the impunity to carry on. There has to be consequence, right? And that's why human rights remain a guiding point. That's why human rights are solution orientated, because it doesn't take sides. It takes the side of humanity. It takes the side of justice and dignity for all. And that remains what I hope will be the compass, and that's what should be guiding us. And so human rights are as strong as they have been. We just need all of the world leaders to summon the economic, political, diplomatic power that they have to make sure that this genocide ends.
Thank you. We have a question online. Ridwan, if we can unmute yourself.
Yes, thank you so much. My name is Ridwan Karim Dini Osman. I'm a journalist from Ghana, and I have about 2 questions. The first one, there are about 67 countries in the world that criminalize homosexuality, and about half of them are in Africa. And I'm sure you know that recently my country, Ghana, passed a legislation criminalizing homosexuality, even though the president is yet to sign it. I have done some work in Malawi as well, where the community members go for healthcare, and they are giving the Bible to say that they have given their lives to Jesus Christ before they can, get treatment. Else, I mean, they never get any sort of, care from the workers. What has been the level of engagement with countries where these laws exist, and are you making any headway at all? The second question, we've seen that after the pandemic, a lot of organizations are cutting back on aid in the area of HIV and other health-related programs. What impact do you see in terms of access to healthcare? And in fact, if any work has been done in that area, I would love to hear what you found out.
Thank you so much. I'll start with the question of aid because it's very important, and I reference a lot of the global health architecture and how much of it is dependent on philanthropic capitalists and global aid to sustain very crucial health sector and health services in the so-called global south. And one of the immediate, most obvious things would be to say those governments in the low-income sector should just support their own health systems. But they do have other, of course, important sectors such as, development, education, to be, of course, investing in. And the question is, why do a lot of these so-called global south countries not have enough GDP to sustain their own health sectors? And so there is a historical context to it. And that's why when I undertook this mandate, I said I would employ analysis that are anti-colonial and anti-racist, because there is a story to tell about why certain countries experience extractive capitalism, where a lot of their rich resources do not actually benefit the people in the country to invest back into system, into social system, into health systems to yield positive health results, where it then creates dependency on donor aid and health funding. Global solidarity is something that is encouraged, of course, within the UN and member states, but it can't be that when one political party is elected in one superpower, aid is being threatened for HIV care, for example. So there are those nuances that are happening. And a lot of these countries are servicing debt even higher than their GDP. And so they can never really come out of the poverty cycle as a country, as an economic sector, as a region in the world. So when it comes to the anti-LGBT and Ghana specifically, we have had some interventions together with my colleagues, the independent expert on SOGI back at the time in 2021, where we did write to the government of Ghana, putting forward our concerns on those bills, giving them the frameworks in terms of international human rights laws and standards. And of course, I was coming from a right to health perspective. We had other colleagues coming at it from the perspectives of education, for example, because we know that human rights are interrelated and interdependent. And so when you take away one right, the reality is that you are going to impact or enable other human rights violations in other sectors as well. And so the social exclusion of LGBTIQ plus people is something that's really worrying, because it enables systemic and structural violence, and it actually makes it okay for societies and communities to violate people on an interpersonal level when it's legally okay to do the same. And the issue of recourse is one that is really important, because to get recourse, it means the violence has to happen. And my argument is that we need to prevent. The power of human rights is in the prevention as well. And we need to do a lot more work and advocacy and technical support in how do we prevent human rights violations. But of course, it is important to also talk about how do we get justice where violations happen as well. But just to let you know that indeed there has been communication on the 9th of August 2021 on this particular issue with the government of Ghana. Thank you.
Thank you, Ridwan. Do we have any further questions? If not, thank you so much to the Special Rapporteur. And please bear with us. We'll be back in a few minutes with another press briefing. Thank you.